Next, we have Dr. Howard Hu from the University of Southern California. Dr. Hu is a leading physician, scientist, and epidemiologist who has held very prestigious positions, including as tenured professor, director, department chair, and dean at Harvard, University of Michigan, University of Toronto, and now at University of Southern California. He's currently professor there and chair of the Department of Population and Public Health Sciences in the Keck School of Medicine at University of Southern California. He's incredibly well published and respected in the fields of environmental, nutritional, social, genetic, epigenetic determinants of adult chronic disease and impaired child development in population-based studies. He's been doing loads of research, including out in the field and international. He's leading several COVID-19 cohort studies and many other accomplishments. We're really pleased to have you. Thank you. Please, over to you, Dr. Hu.
Thank you very much. First slide, please. So first, huge congratulations for GAP for convening this forum. And you just heard from one of the leaders, not only in assembling the scientists, but also in advancing this entire agenda globally. I've had the great privilege of providing some contributions towards the UNICEF Toxic Truth Report, and I would identify that as one of the documents that would be the go-to document for anybody who wants to understand the scientific basis, as well as what the societal implications might be. Can you put up the slides, please? My job today is to explain a little bit more about the science and why we know what we know. Next slide. One of the reasons why you keep hearing from Richard and others that lead is so toxic is because it simply is a chemical the body has not had any developmental experience dealing with. It's called a xenobiotic, a chemical that is not naturally present within an organism. And what it does is that it mimics various elements like calcium in the body, but it doesn't actually fulfill calcium's functions. Instead, it interferes with calcium-dependent processes like synaptogenesis, the formation of brain connections when you're growing, brain function, because calcium is involved in the neurotransmission process, and it also amplifies oxidative damage, which we now know is the accelerant for aging-related processes around the entire body, which is why we're seeing these accelerated degenerative processes in the cardiovascular system, in the brain, the eye, and elsewhere. Next slide. This is from the Toxic Truth document, a compilation of all the different adverse effects you can expect in children and in adults. And they basically coalesce around brain function, the cardiovascular system, the heart and the blood vessels, the blood system that creates new blood, and also reproductive outcomes like spontaneous abortion, birth weight, birth size. Next slide. How do we know this? Well, this is the result of hundreds and hundreds of well-designed scientific studies done in the laboratory on experimental organ systems and in hundreds of really rigorous and increasingly sensitive epidemiologic studies done all over the world. On top of that, there's a process that we scientists go through called systematic review, where we bring all these studies together, weigh all the evidence, and come to conclusions about causality, the dose-response relationship. Just how toxic is this at the very lowest levels of exposure? These are why these documents and these bodies of scientific knowledge are so persuasive and why we must act. Next slide. Now, to just give you a sense of how sensitive the human neurologic system is, these are these dose response curves that are examples of the research that's being done. The graph on the left is a pooled analysis of a number of international studies that were done, which gives you a sense of the increase in blood levels on the x-axis and the decline in IQ that can be expected. And one of the things you can notice is that the declines at the very lowest levels of exposure are much steeper than they are later on. And that's because of the sensitive processes that occur that relate to the things that I mentioned, called synaptogenesis, brain formation. And on the right is another dose response curve from a study my group did, in which we're looking at indices of hyperactivity among children, showing that even at very low blood lead levels, we can see increases symptoms of anxiety, hyperactivity, inattention. Next slide. Richard mentioned that one of the game changers that might influence even further the policymakers is an assemblage of studies suggesting that lead actually increases aggression and violence. And these are some of the exemplar studies that have done this, and it's still actually subject for systematic review, one that I'm involved with that's being conducted by the U.S. Environmental Protection Agency. Next slide. Unfortunately, there are no treatments. In this study published in the New England Journal some 20 years ago, a randomized multi-center trial of the one medication that does remove lead from the body showed, in fact, no effect on reducing the impact in IQ. In fact, one of the side effects that was noticed of the treatment was that it removed the essential minerals that are needed for growth, and children who received the treatment were significantly shorter. So there are no treatments for lead poisoning and IQ. Next slide. These kinds of studies have persuaded various governmental agencies, like the U.S. Centers for Disease Control, excuse me, to sequentially lower the amount of lead that's acceptable in a child's blood. And you can see here over time how it's gone down. And essentially at this point, CDC has concluded that there is no safe level of lead in which we can't find an impact already on learning and intelligence. Next slide. And as far as adults, what we have seen is that the cumulative exposure over years that happens when you're inhaling leaded gasoline, or you're exposed to lead in water, or all the other sources of lead exposure, that cumulative exposure over time puts you at risk for hypertension, heart attacks, stroke, neurologic diseases. And these are one study that our group did using a special biomarker of lead accumulation in the body, X-ray fluorescence measurements of lead in bone, to demonstrate this effect in epidemiology studies. Next slide. These are the other spectrum of outcomes that we now know are at risk with chronic lead exposure in adults, including these neurodegenerative diseases that are so feared as we enter our older ages. Next slide. So in conclusion, we know a lot about lead's impact on non-communicable diseases. These are insidious effects. You don't feel them. People don't complain about them. But when we do the studies, we can see the impact all along. The treatments for acute poisonings, which chelation does work for, does nothing to reverse the long-term damage in either children or adults. And the overwhelming solution is prevention. Finally, next slide. If we think about where we need to go, some of the very initiatives that GAP is advancing, preventing lead exposure in children is advancing, can be enacted by understanding the lead exposure situation in your region. Sometimes it requires actual blood surveys in children and pregnant women or adults to understand the spectrum and the distribution of blood lead and the associated exposure. And then, of course, the policies that will reduce that lead exposure, particularly in children and women of reproductive age. Thank you.